You're watching Prostate Cancer, a matter of fact, on ABC 27. Brought to you by Penn State Milton S. Hershey Medical Center.
Welcome back. A Hummelstown man dealt with an elevated PSA for 9 years. Then he got the news. He had prostate cancer. Here's his story. Pieces of glass turned into a work of art. Don Garland's specialty.
I'm just starting to dabble around now with a new pattern that I just copied, and I just traced out a couple of pieces.
Don cuts the glass into special shapes, smooths out the edges, then pieces them together. So many details. And details is what Don wanted when he found out the news.
I was very shocked when I did receive the phone call that it was initially that I had an elevated PSA, and quite frankly, that began the education process of what did all this mean and what was the next step and what was going to happen.
These questions began back in 1999 when Don retired from the military. Over the years, doctors watched Don's PSA level, which included 4 biopsies.
It was up and down for every 6 months from 2002 to 2006, and then for some reason it just started elevating again.
Well, you try not to overreact, and you try to be a supportive spouse. So we just said, well, we'll go with what the doctor said and we'll plan accordingly.
Sometime in early 2008, March, April, I was starting to have some other side effects and symptoms that I knew would possibly be cause me some problems.
Urologist Dr. Carl Reese suggested another round of biopsies.
That biopsy demonstrated we found a very small focus of prostate cancer in his prostate gland.
In the back of my mind, I always kind of suspected that it was there. The cancer was there. And my wife and I, we came to the conclusion, and obviously we prayed about this and said, okay, Lord, what are you going to do? What do you want me to do? I'm depending on you to give us the guidance here.
We knew at some point you do not play with these numbers without it ultimately becoming malignant.
The bad news is he's got prostate cancer. The good news is it's very treatable, and there's a bunch of good treatments out there for him.
We pretty much had made up our mind from the years that I've been having the problems with this elevated PSA and all these biopsies, and we always played the what if scenario. If it was cancer, what would we do? And we finally had come to the conclusion that the best thing we should do is just get it removed.
A day after their 41st wedding anniversary, Bev remembers the morning of the surgery.
I did well until he left me and had to go in that intermediate room. Then I sort of fell apart. Any surgery is major surgery. And yes, you anticipate them coming through surgery, but you really don't know. Once you say your goodbyes, you don't know.
Dr. Reese explained the surgery.
A radical retropubic prostatectomy, which is an open, it's a small incision below the umbilicus, below the belly button, usually about the width of my hand, and I have a small hand where we go in and we remove the prostate and sew things back together.
Don spent less than 4 hours in the OR. A day later, he went home. Then he got the good news.
His report was very favorable. He did have a small tumor in his prostate, about the same area that we biopsied it. The margins were all negative. That means there was no cancer near the margins. He had a clean, healthy tissue around it, so we didn't leave any cancer behind with it.
Dr. Reese says Don is cured.
It was a big relief, yeah, definitely. And we knew at that point that once we'd heal up and we'd get back to some normalcy in our life, and that was great.
I was thankful. I was thankful that the Lord saw us through that time and was gracious enough to allow us to have more years together. So we're just grateful.
Don tells me by 4 weeks he was able to cut the grass. 6 weeks he went back to work. It's been 2 years now, and he says everything has been fine. We'll send it back to you in the studio, Chuck.
Thank you, Deborah. And Dr. Reese joins us in the studio now, and we were looking at Mr. Garland's story there. His PSA numbers kept rising, but there was no sign of cancer. Is that rare?
That's not all that uncommon, Chuck. We see that quite frequently. There's a lot of things that cause an elevated PSA. Only about 20% of the time do they have cancer. The other 80% of the time they have something else, such as infection, inflammation. Recent ejaculation can also cause that. I'm sorry.
Well, we talked a little earlier before the show. A lot of men talk about, oh, my PSA is going up. But they don't know what PSA is. What is that?
PSA is a substance that is produced by the normal prostate. It is used in normal sexual function. It's elevated, we feel, in prostate cancer because the cells of the prostate cancer are leaky to the blood vessels. So the PSA that they make actually leaks into the blood vessels, and we're able to detect it at a higher level.
You're telling people to be screened, telling men to be screened. Why is that important?
It's important because if we catch prostate cancer when it's early, we can potentially cure it, and we can save lives later on down the line.
And there are more and more people responding. What's an age? What age should I be concerned? I'm 64. I've been getting screened pretty regularly. Is there a start age?
What we recommend for starting for screening of PSA, we recommend the American Urological Association recommends doing a baseline PSA between 40 and 45, and then starting an annual digital rectal exam and a PSA at age 50. In African American men or men who have a family history of prostate cancer, we recommend starting that screening at age 40 and then doing it annually thereafter.
We've been talking about this cancer now for 25 minutes or so, and there might be people out there saying, I wonder if I have a sign or a symptom. Is there something they should watch for? Can a man watch for that?
Early in prostate cancer, there are usually no signs and symptoms. They're totally asymptomatic. Late signs of disease, they can develop pain in their bones, they can have difficulty voiding, they can feel poorly because the prostate cancer is much more advanced.
All right, we'll break for right now, but Deborah Pinkerton's in the ABC 27 call center. What questions are we getting in there, Deborah?
I'm 78 years old and was diagnosed with prostate cancer over a year ago with stage T2 and a Gleason of 6 with a PSA of 2.0. Is it safe to just get checked every 3 months?
That's a very good question. Short answer is yes for this gentleman. Again, it points out that prostate cancer is very individualized, and we use these parameters, Gleason's score, which is a measure of how ugly the tumor looks like, PSA, patient age, comorbidities, etc., to come up with an idea of how much the patient is at risk to die of prostate cancer versus other things. And for this patient, just observation would be very reasonable with those parameters that were described.
Okay, thanks so much, and we'll send it back to you in the studio, Chuck.
Thank you, Deborah. Doctor, the last question referred to T2 and Gleason of 6. Tell me what that is.
First, I'll talk about the T stage. When we stage prostate cancers, we use the TNM, or tumors nose metastasis. When we're talking about the T stage, the tumor stage, a T1C is a patient with an elevated PSA and a normally palpable gland, and that's the majority of the prostate cancers we're diagnosing because of the elevated PSA. A T2 cancer is a prostate cancer we can actually feel. A T2A is a small little nodule that you'll feel. T3 cancers are cancers that are extending into contiguous structures such as the bladder or the seminal vesicles. And T4 disease is tumor that is spread outside the prostate gland into other structures in the pelvis, such as the pelvic sidewall or the rectum. When we're looking at the Gleason score is an architectural grade. It's how the pathologist looks at it under the microscope. And it goes from the grade goes from 1 to 5. Grade 1 being the most normally looking cells and grade 5 being the most abnormally looking cells. The pathologist looks at the specimen underneath the microscope and he assigns a score, which is the most predominant pattern that he sees, and then the second number is the second most predominant pattern, and that's where they'll come up with the score, or the Gleason score. In this particular instance, he had a Gleason 6. Usually, most commonly, it's a 3+3.
That's a lot to cover in a few short minutes, but when in doubt, come in and talk to the doctor about it.
Yes.
See how that works. Thank you, doctor, for joining us here tonight.